When I was 9, my family lost my uncle, the eldest of his generation, and a source of guidance, wisdom, and joy to us all. As I've grown older, I realized just how deep the tragedy is because we didn't lose him to a heart attack. He died by suicide. As a licensed clinical psychologist, as well as a Hindu American invested in my community, I've lost far too many family members and friends to the tragedy of suicide. From a young age to just a week ago, I've been slammed with the pain of losing people to a cause of death that feels so important to talk about and address.
When I think about the people in my life that I have lost to suicide and those who have survived suicide, the only thing the people that have survived suicide have in common is that they had one person, at least one person, that was available, present, that was there to listen, that was there to help them heal. And so that is why a service like 988 is so critical.
One of the most harrowing moments during my medical training involved getting a message on the patient portal late at night that a 19-year-old patient of mine wanted to end her life. I immediately called my patient, who had run away from home at age 18 and now felt like she had no place left to turn to. My patient was an immigrant who felt the strain of trying to live up to her family's dreams for her, ultimately running away but finding herself cut off.
The root cause of suicide is basically depression and anxiety. But what causes depression and anxiety is the expectations that one has of the people, places, and situations. And when these situations confront us in life and they become too much to bear, what happens is we become depressed or anxious. But there's always tomorrow, and there's always the realization that people, places, and things are always changing, and there's always a light at the end of the tunnel.
From a Hindu perspective, suicide is heavily criticized. It would be a most unfortunate decision on anybody's part. Just as the physical body has ailments, sick, you go to a doctor. So too the mental body has ailments, depression, anxiety, fear, guilt. Just go and ask for help. If there's nobody, just call 988 and there'll be a person right there willing to help you out.
The 988 dialing code is just a first step towards strengthening and transforming crisis care in this country. It serves as a universal entry point so that no matter where you live, you can reach a trained crisis counselor who can help. 988 offers 24/7 access to trained crisis counselors who can help people experiencing suicidal, substance use, or other mental health crises. To reach the lifeline, people can call or text 988 or chat at 988lifeline.org. If you need suicide or mental health related crisis support or are worried about someone else, visit the National Suicide Prevention Lifelines chat to connect with a trained crisis counselor.
Good afternoon, everyone, and forgive me for being on phone and not on camera, but I want to thank everyone for joining us today, and thank you to the Hindu American Foundation for working with us and their leaders to bring together the community to address suicide prevention and increase awareness about 988. This PSA and many others like it that the center produced with partners are examples of how faith communities and leaders can be part of the solution to making sure as many people as possible know that when they are desperate and need someone to talk to, they can call 988 to get help, and they can join the more than 10 million calls that have been answered, whether via text or chat or over the phone, from people looking for help with suicidal thoughts and mental health and substance use related crises. And to make the system connect with as many people as possible, the Biden-Harris administration has invested nearly $1.5 billion into 988 as part of the administration's comprehensive strategy to address the nation's mental health and substance use crisis more than any other administration. So while 988 is making a difference and saving lives, it is still striking to me as I travel around the country and learn that people still don't know that 988 is an easy and safe way for people to get the help and support they need if they are in crisis. That is why this year, United States Department of Health and Human Services Partnership Center and the Substance Abuse and Mental Health Services Administration is launching the 988 Day and Faith Weekend of Action efforts. On the weekend of September 6th through the 8th, we are asking for faith communities to commit to take action and make sure as many people as possible know that there is help available if they need it. And so in the webinar today, you're going to hear from some amazing faith leaders who are addressing suicide in their communities. And these stories serve as strong examples for all faith leaders and communities, highlighting the importance of seeking help when someone is in crisis. 31% of U.S. adults say they would feel extremely or very comfortable talking about their mental health with a spiritual or religious leader. Faith leaders serves in a unique position to provide a platform for awareness and education campaign about 988, suicide, mental health, and substance use disorders. So we need you to help us, help others, even if it's for yourself. So I hope everyone on this call engages with their faith community and leaders to find ways that we can talk about suicide prevention and 988 on the weekend of September 6th through the 8th. For more now on 988, I am pleased to turn the webinar over to Monica Johnson, who serves as the director of the 988 and Behavioral Health Crisis Coordinating Office. Monica, over to you.
Thank you so much. Thank you all for just being in this space together today. I think this is so important and so critical for a variety of reasons. Dr. Q just really hit home on some of those key points. But I want to welcome everyone. Again, I'm Monica Johnson. I'm the director for the 988 and Behavioral Health Crisis Coordinating Office here at SAMHSA. And it is my honor and privilege to welcome you to this gathering today of esteemed leaders from the faith community and behavioral health leaders alike. I do want to shout out and just give props again to Dr. English and the Center for Faith-Based and Neighborhood Partnerships for organizing this important discussion today and for the opportunity to speak with you all. I've been working in behavioral health for 27 years. And if you have ever heard me speak, I say that all the time because the context matters in that I am going to say something really important now. And that context of how long I've been doing this is relevant. I've not seen anything as transformative as 988. I have not seen anything that has served as a catalyst to really, really look at how we respond to behavioral health crisis care and how we make sure we have the systems in place to give people the right help, the right support when they need it at any moment of the day, any time of the year. So to bring together this dialogue today to ultimately lift up 988 Day, I am just so honored and privileged to be able to do that. Having been working in this field for the amount of time I have, I've worked in local communities, I've worked in like county level government, state government, and now obviously federal government. And what I know from all of those different roles and all of the many different seats that I've had during that time is that this work has to be done in collaboration between government and community organizations to provide people with the care that they need. I know firsthand the positive influence that faith can have on our mental health within our communities. And I also know that coming up from a family that spent Sundays in church, Wednesdays in Bible school, and Sundays maybe 2 times in the camps at Bible camp. So I come from a background full of faith leaders within my family as well. But we know that, especially in Black communities, the role that our religion can play in our mental wellness overall. In many neighborhoods across the country, especially in underserved communities, churches, synagogues, mosques are not only houses of worship, quiet places of reflection and meditation, educational programs, and places where people can come together to receive the support that they may not be receiving at home. So you're so much more than a place to worship. For many people, this is another home, another connection that is very important to who they are as an individual. Faith can have a profound impact on people's mental, emotional, and spiritual well-being of our communities. Dr. English referenced earlier, because we do have some research that does demonstrate that over 31% of US adults report feeling extremely or very comfortable talking about their mental health with a spiritual or religious leader. And we see that this number increases to 58% among those who attend religious services at least once a week. Trusted faith communities are often the first place that people turn when they are experiencing a crisis. And this makes faith leaders the ideal messengers to help increase and help spread awareness around mental health wellness. And I'm going to back it up a second, behavioral health wellness, because I'm talking about all the things. I'm talking about those individuals that are having thoughts of suicide. I'm talking about individuals that are feeling isolated, depressed, dealing with anxiety, dealing with grief and loss. I'm also talking about individuals that may be struggling with substance misuse or have a family member that may be struggling as well. So we're talking about all of those different issues when I talk about the big tent of behavioral health wellness. So today we have the chance to forge powerful partnerships between the faith-based communities and behavioral health organizations and practitioners. I encourage everyone here to share the resources, information, and outreach strategies you learn throughout this webinar within your faith communities. I truly believe that by working together, we can promote mental health resources, behavioral health resources, and services much more effectively. We are excited that this is our inaugural 988 Day on September 8th, and you will play a critical role for us on that. So as we move forward, remember your role. Remember that your voice, your leadership, your efforts in helping to promote mental health and well-being within your faith-based communities is paramount. So once again, thank you for coming. I look forward to hearing more from our speakers today. Thank you so much. Ben?
Monica, thank you so much for being with us today. Thanks for your leadership there at 988 and all the work you're doing to bring these leaders together and provide resources to the amazing work that's being done. Thank you so much. You know, throughout this call, we're going to have a chance to hear from some amazing faith leaders who are working to address the challenge of suicide prevention in their communities. And one of those first leaders we're going to hear from is Reverend Horace Sheffield. He's going to share why suicide is a topic that he addresses there in Detroit and something that he addresses in his faith community. He serves as the pastor of New Destiny Christian Fellowship, but he is also executive director of the Detroit Association of Black Organizations. Reverend Sheffield, we're so excited to hear from you today.
Thank you so much. Let me just say that my introduction into most of this work has always been through some situation that presented itself as a pastor or as a community leader. Several years ago, I was having an anniversary service with a guest church, and a young lady in the audience seemed to be fixated on me. And after service, I went to talk with her, and she immediately said to me that she wanted to kill herself. I took her into an office and began to talk with her more. Knowing that her father was there, I introduced him to the conversation. He was more embarrassed than he was empathetic, ceased the conversation, and took her home and had her pastor come over. And from what I understand, spent several hours, because even in front of me, he was telling her, "You're not going to do it. You're just talking." The next day, she suicided. That made me immediately want to figure out how I could be of more help from a clinical standpoint, from a practical standpoint, because I believe in prayer plus. I believe that the power of God is available to us and can perform supernatural acts, but it requires people who've been gifted, have training, and have knowledge. And that's when I got trained in QPR. I've been involved with this for about 5 or 6 years. Been blessed to enlist the work of my friend and sister, Erica Alexander, who is just won an Oscar, in fact. And her mother attempted suicide 5 times and was unsuccessful. And every year we began what we call Project Rainbow. We've trained probably about 2,500 people and certified them in QPR, 26 trainers. We do this every Wednesday at the Sheffield Center. We train people, but we focused on churches. And again, I talk about Prayer Plus because I think many of our churches, some pastors still believe they can lay hands or sprinkle some oil and it all goes away. We need a technical, therapeutic way of intervening in the lives of folks who find themselves in crises. And so it's been my real honor and duty, if you will, to provide this training, to speak to people about what this means to be able to prevent suicide. There are clinical, proven methodologies that can assist in that regard. And that's why I'm also glad to have been part of the inaugural launch of 988 and featured in the video. I disseminate that to people all over the country. I encourage pastors to get our training because we can make a difference in this regard. I'm excited to participate in this relaunch or this massive effort to get people to utilize 988, to know about it. In fact, I'm having some special activities on those days. I'm a part of the Word Network. I've already secured permission of Kevin Adele to run an actual special on that day that will share with people how they can access 988 and how they can do things that will intervene and save lives. I'll just say this. I believe so much that many of us have the ability to help people who are in crises. One of the fundamental things we have to do, besides being empathetic, is knowing where to direct them or to help the people around them get the help that they need to make certain that it can be responded to. 988, as our good doctor just said, is such an addition to that tool base, to that toolbox. And I'm so pleased and privileged that Dr. Q English asked me to be a part of this and that it assists us in the work that we do in the city of Detroit. Thank you so much.
Thank you, Reverend Sheffield. Thank you for the work you do to help people know more about question, persuade, and refer QPR trainings. You're an amazing leader on that front, and all the work you're doing across the city to really connect people to resources there. We so appreciate that. I'm excited to turn the call back over to Dr. Jill House, who is with the 988 team, to introduce Jill Mays, who's joined us. Or you know what, let's just go to Jill. We're so excited you're here with us from the team. You serve, so appreciate your leadership, serving as the Division Director for Crisis Systems Transformation on the 988 and Behavioral Health Crisis Team. Jill, tell us more about the difference the 988 is making in communities. We're so excited to hear about that.
Good afternoon, everybody. I'm very excited to present to you today. As Ben said, I'm Jill Mays, Division Director for Crisis System Transformation in the 988 office. And when I'm not at my day job, I'm an associate minister at a local Baptist church in Decatur, Georgia. I'm also a person with lived experience of having suicidal thoughts and a suicidal plan. And the fact that I'm here live today is, in my opinion, nothing short of a miracle, and partly attributable to my pastor and his wife, great people of faith who poured into me and prayed for me, but also did a very significant thing, is that they recognized where their expertise ended and referred me to a therapist. And because of that, I'm here today excited to tell you about 988. And I think that everyone should be a part of spreading the word to people that there is hope available and it's just a phone call away. So I'm going to share my screen and take you through just a few slides about 988 and what the line is. So let's talk first about the need for 988. Too many people are experiencing suicidal and mental health and substance use crises without the support and care that they need. And sadly, the pandemic only made a bad situation worse when it comes to mental health and wellness in America. And there are urgent realities. If you'll see on the screen from some 2022 NISDA data, that shows that 950,000 youth, and this is important for us to see, these are youth, young people, ages 12 to 17, and 1.6 million adults attempted suicide in 2022. And suicide rates have increased from 21 to 22 for nearly all populations, as you'll see on the screen. And in 2023, 107,543 people died from drug overdoses. Now, there's hoping that that's a decrease of 3% from the 111,000 roughly deaths estimated in 2022. And this was the first real annual decrease in drug overdose deaths since 2018. So progress is being made, but there's still so much work that we need to do to spread the word that help is available. So what is 988? 988 is a safe place. It's open 24/7, 365 for anyone across the country to call to talk about whatever's bothering you or someone you care about. So what happens when you call the line? If you contact 988, trained and caring counselors listen to you and work with you to understand how your problem or a loved one's problem is affecting you or them. The counselors provide support, work on safety planning, and if needed, share additional resources in the community where you can get additional support. It is important also to note that the vast majority of people seeking help from 988 don't really require additional interventions at that moment. Only fewer than 2% of the 988 contacts require a connection to emergency services like 911, and those are called in under what we call emergent circumstances to save a life. So it's important that the 988 information get to communities that have historically been underserved. And because of that, 988 has a Spanish text and chat service where Spanish speakers in crisis can reach out to trained and culturally competent Spanish-speaking counselors. We also have a specialized call and text and chat support for LGBTQI+ youth and young adults, as well as an American Sign Language and video phone service for people who are deaf of hard of hearing. And many of you may also be aware of the Veterans Crisis Line, which you can call 988 and press 1 to be connected to counselors who are very familiar with the unique needs of veterans and military families. And we also are working on every day on culturally competent services for American Indians and Alaska Natives. So equity or embedding equity in our services is very important to the 988 office. So how have we been doing? From 2022, when the line was, when the Lifeline transitioned over to 988 to 2023, 988 answered 1.4 million more contacts in 2023 than in 2022. The chat answer rate increased from 65% to 94%. And the Spanish voice answer rate went from 66 to 84%. And data for the months following the transition to 988 show that while all the answer rates are significantly improving, what this actually means at the core is that more people are getting connected to care and getting connected sooner. And this past July marked the 2-year anniversary of 988. And you'll see on the screen that in those 2 years, 988 has answered more than 10 million texts, calls, and chats. Following the $1.5 billion Biden-Harris administration total investment in the 988 line and the crisis continuum. So the vision for 988 is a bold one that just starts with the 988 line, but it's a plan to transform behavioral health crisis care in our nation from the 988 call to mobile crisis response in the community to stabilization and receiving facilities where people can get additional higher levels of care to get them stabilized back into their communities and back with their families. But that such a bold vision needs help. And we continue to do this because of people like a woman who responded to our formative research study. And she said when she called 988, it finally felt like someone cared to just listen and to provide help if I wanted it, which was exactly what I needed at a time when life felt like too much to handle on my own. How many of us have ever felt like that? I never felt judged, and our conversation helped me remember that I wasn't alone. And this is a message that we're hoping that you all will help us to spread to the members of your congregations and your faith communities, that they don't have to feel judged. Help is available and they are not alone. But again, to transform the system, the 988 office can't do it all alone. SAMHSA can't do it alone. We need you all to help us, to join us in partnership. This is a job that's too big for just a few hands. So we're asking today for everyone in the faith community to learn more about 988, learn more about the need for crisis services in your communities, and learn how to connect. As Director Johnson told us, people are comfortable coming to talk to members of their faith community when they're in crisis. And it will be wonderful, just as it was for me, if the person that they come talk to knows that there are community resources and can direct them that way. So if you'd like to learn more, there are two websites here. We have an information and promotional materials website, samhsa.gov/988. And for people who are needing help, this is a website that you can share where they can connect to chat services, 988lifeline.org. And also, if you'd like ongoing information, here's the information to sign up for our SAMHSA 988 partner newsletter. And when you get the newsletter, you can also find links to connect to our website where we have a partner toolkit that has information, downloadable tools, slides. You can get free of charge stickers and other materials to pass out to your congregation. So we hope that you will avail yourselves of that information. And I'm going to stop sharing and then turn it back over to Ben. But thank you all for joining us today. Again, we need your help in spreading the word about 988, and we're excited to share more with you later about 988 Day and our Faith in Action Weekend. Ben?
Jill, thanks so much for helping everybody know more about 988, the critical work that it's doing, and the amazing difference it's making across the country. We so appreciate that overview and the helpful resources that were described in that series of slides and that presentation. We're so pleased to turn next to another leader who's doing some great work in this space. Imam Hossam Musa is the Imam at the Islamic Center of Greater Cincinnati, one of the largest mosques there in Ohio. And he's going to share a little bit about why this is an important issue to him as well. Imam Musa?
Thank you, Ben, and thank you, esteemed panelists. It's an honor and delight to be amongst you. And I'd like to begin by reciting a part of a verse in the Holy Quran, and that'll highlight why this is so important to me. God Almighty says, وَمَنْ أَحْيَاهَا فَكَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا. And one who supports life is as if they have saved all of humanity. And for that reason, I think it's extremely important to me to support life and to prevent as best as possible suicide. That being said, early in my career, over 11 years ago, in my first 6 months as imam, I tragically led 3 funerals that were by suicide. And that struck a nerve, or at least made me reflect and want to learn how I can do better in dealing with this crisis. So I started attending more mental health awareness training programs, suicide prevention training programs, such as the one provided by Maristan and Dr. Rania Awad and others, and continue to try to better prepare and equip myself to better lead my community, especially in this area. After attending several trainings and continuing to do so, I came back to my community and started to address mental health awareness, suicide prevention through our weekly Friday sermons, so similar to Sunday Mass, but for Muslims, we meet on Friday at the mosque. Also continuing to bring mental health professionals to address our community and raise awareness and create programs. Also created a team, a mental health crisis team, as well as a suicide prevention team and awareness in our community. And we just started a free health clinic. And now I'm trying to work with the leaders of that clinic to have a mental health segment or service to be provided through that. These are some of the ways we're trying to work on bringing awareness to our community, and definitely on the weekend of September 6th through the 8th, I definitely plan on raising awareness in our community about the 988 crisis number, and to make that more accessible, to bring that to our community's attention. And that way it is an additional resource to support our community, especially in its time of need. Again, I value and appreciate the work done by all of our esteemed leaders and panelists. There's a lot more for us to learn from each other and work together to support our community in the best way possible. Once again, thank you very much. And I hand over the mic to Dr. Laura House. And without any further ado, Dr. House.
Good afternoon, everyone. I'm Laura House, and I am the External Engagement and Equity Officer for the 988 and Behavioral Health Crisis Coordinating Office. We're so proud to announce today the first observance of 988 Day on September 8th this year in 2024. And our Faith in Action Weekend, which is actually a part of our 988 Day observance this year. So what is 988 Day? Next slide, please. 988 Day is a nationwide initiative. It's a nationwide initiative dedicated to creating a positive buzz around the 988 Suicide and Crisis Lifeline and its related activities across the country. Its goal is to raise awareness of 988 in fun and creative and interesting ways, beginning an annual tradition. We have as our theme this year, No Judgment, Just Help, to positively promote 988. And then share what you do during the weekend, 9/6 to 9/8 on social media using the hashtag #988day, or as we're encouraging, #988day Faith in Action. Next slide, please. Now, we see, as Director Johnson mentioned, and Jill Mays as well, and others, we see and we know the important and unique role of faith leaders and faith communities in this effort to educate about 988, suicide, mental health, and behavioral health overall. And we are very deeply aware and respectful and appreciative of the critical and unique role that faith leaders and faith communities play across the nation. Next slide. So as a part of our 988 Day observance, we're also initiating what we're calling Faith in Action Weekend from September 6th through September 8th. And what this will do is offer faith leaders and faith communities the unique opportunity to integrate 988 into your worship services, your faith-based activities, and your community gatherings. We're making a proactive call to you as faith leaders to join us in this work. And we're asking that you promote awareness about 988 suicide prevention and crisis services, including mental health, substance abuse, and overall behavioral health during this period and beyond. Next slide, please. So, to support you in answering the call to action, we just want to share that we've developed some resources, several resources, and these include the following. The first is a 988-day digital toolkit, which includes a range of digital and print materials, including faith-based images that will help you effectively promote and engage with your community from 9/6 to 9/8. We also have developed a 988-day Faith in Action webpage that will be a part of our 988-day digital toolkit, and it'll be available early next week that you can share with your communities. Additional resources will also be available to you that you can share as well. So stay tuned. We'll follow up with you to share that information. And then we also have a 988 Faith in Action flyer that's available now that you can share with your communities, and you can post it to advertise our 988 Day and 988 Faith in Action weekend. Finally, this is really cool. We have a hashtag. We have an overall hashtag for 988 Day, which is pound 988 Day. But we also have another hashtag for this special effort, 988 Day, pound 988 Day, Faith in Action. And so we are asking you to use it to post encouraging words and photos of your activities during the weekend from 9/6 to 9/8. And here you'll see an example, some inspiring examples of how others have creatively promoted 988 in their own community. And I'm hoping that these spark some creativity as you come up with your own unique ideas for this effort. Next slide. So please share your efforts with us on social media using the hashtag pound 988, Faith in Action Day, or pound 988 Day. Your post will go to the same wall so that people can see the fantastic, amazing things that you're doing to promote 988 and the work that we're doing. I also just want to say in closing that we thank you for all of the work that you're doing across the nation in your faith-based communities. It is so important. And we just thank you for answering the powerful and life-changing call to action as faith leaders and faith communities. We see you and we appreciate you. With that, I now want to turn the program back to Ben to share a few more remarks.
Thanks so much, Dr. House. I so appreciate everybody being with us, for Jill sharing about the great resources that are coming from the 988 team and the ways that folks can be involved. Hopefully you can see me, but if not, you can hear me as I talk about some of the key things that we want to encourage faith and community-based groups to consider as a part of the action items that they can take to increase awareness about 988 in their community. First off, we want to make sure you have key points on 988 at your place that you can share in your house of worship. You know, we've already talked about how a person dies by suicide every 11 minutes. That means it affects so many in our communities. It affects people we know and love. And we want to make sure that people know that 988 is an easy to remember number that is providing greater access to life-saving services. Anyone in crisis or someone supporting a person in crisis, which can include faith leaders themselves, can reach 988 in the United States through any landline, cell phone, or voice over internet device. It is accessible, it helps people get there, and everybody can know that 988 is that easy to use number that'll connect to those services. It offers 24/7 judgment-free support for mental health, substance use, and more. Anyone can text, call, or chat 988. Lastly, it's just so important. You're not alone. Someone who's in crisis is not alone. Someone who's struggling is not alone. There is no judgment, just help, and it's available when someone texts or calls or chats 988. These are the key messages we want to make sure faith and community leaders know about, and think about ways that they can talk about it. And we so appreciate some of the leaders who've joined us already talking about how they're going to use that weekend to share some of this information with their community. Next, you've seen some of the PSAs that are available, and we'll make sure, I think we've put it in the chat. There's going to be other ways you can get to those. We'll make sure to include them in the link for everyone who registered to participate in the webinar today. But we have videos for the African-American community, for the Muslim community. We have videos for the Church of God in Christ, a specific Christian tradition that worked with us to create some PSAs for their community. And so there are PSAs that you can use and reference or connect to for your resources in the community. You can also download images or posters and provide those in your local community, so that you can make sure you can connect people to this important information. You can also share the 988 flyer that I'm going to put in the chat here in a second, so that you can download that. We'll also have it available on the website that's in the chat, as well as one that we've talked about already. Lastly, you can encourage your congregation to wear purple or teal, which are the awareness colors, for that weekend at your regular house of worship and the services that you host over the weekend. And then lastly, when you're doing this, we've already talked about, use that hashtag 988day faith in action and get your content up on that wall so that everybody can see the amazing work you're doing. These are just some of the ideas. We're excited to hear about other ideas, other creative approaches that you have to increasing awareness about this critical issue in your community. So just consider these. We're going to have these up on the site. There are things, resources that you can look at through there. And we're going to make sure to follow up with everyone who participated today, so that they can connect to some of these resources, make them available. We're doing this webinar ahead of that weekend, ahead of 9/6 to 9/8. So you have time to pull these resources in, connect them to what you're doing in your local community, and think about ways that you can leverage and connect to some of these resources in your community. Hopefully you've gotten some ideas. You're already thinking ahead about some of the ways you can put this into practice in your house of worship, in your community. And so lastly, we're going to have the pleasure of hearing from Reverend Dr. Sarah Lund, who has done such amazing work in this space already. Reverend Lund serves as the Minister for Disabilities and Mental Health Justice within the United Church of Christ, and we're so honored to have her here with us today to share a little bit about her own experience, why this is important to her, and how she is doing work in the community and throughout the United Church of Christ to address this challenge. So, Reverend Dr. Lund, over to you.
Thank you so much. It's an honor to be on this webinar with you all and to know that we are not alone, that we are part of a community that cares to share hope and healing. 988 is about me and my family and my faith community. 20 years ago, I called 911 because I was worried about my father's mental health. He needed someone to check on him to make sure he was okay, and 911 was the only option I had. 4 years ago, my niece was suicidal, and there was no 988, and we lost her to suicide. Just last year, another family member was looking for hope and had plans for suicide. I had talked to them about 988, knowing that young people are at higher risk for suicide. And so they had in their toolkit 988. And I am thankful to God that my family member was able to text and to call 988 and get the help they needed. And they are alive today because of it. So this is personal to me. It is also a matter of great faith for me as well as a faith leader. As a minister in the United Church of Christ, we say no matter who you are or where you are on life's journey, you are always welcome here. And I would add, no matter where you are on your mental health journey. We also say never put a period where God has placed a comma. There is more to your life story. You have a purpose, and God has a plan for your life. Faith in Action Weekend is so important for all of us. I encourage you to get involved. The Faith in Action Weekend, September 6th to 8. There's no judgment in our faith communities. We just want to share hope, love, and help. I also want to invite faith leaders themselves to reach out for help when you are feeling overwhelmed and in despair. 988, it's for us too. You can call and you can text. We also want to encourage you to think about creating mental health ministries in your context. The United Church of Christ has a WISE ministry, welcoming, inclusive, supportive, and engaged for mental health. We've also come to see that youth ministry is suicide prevention. We know how much youth long for genuine, authentic, in-person connection, and our faith communities are designed to connect people authentically with care and compassion for one another. I'm excited to see how faith communities across the country will involve children and youth in the 988 opportunities. A person is never too young to learn about resources to help them and their family members. We always need to remind people that there is no shame or stigma in needing help. And so please join this national movement to stop the judgment and add hope and help to our communities. I'm also excited how our faith communities can partner with others in the local community, libraries. We can print out 988 flyers and posters and distribute them to the libraries, to the grocery stores, to community centers. We can put them up on bulletin boards. We can also invite other people beyond the faith community to partner with us. And we have the heart to do this. We have the volunteers to do this. This is God's work. God is good and God is great, we often say in our faith communities. What about adding to that, God is good, God is great, text or call 988. Don't wait to text or call 988 before it's too late. Love your neighbor, text or call 988. Family members have been one of the 10 million saved by 988. And what is so important is to know that you too can save lives by distributing this resource. And I invite you to do so as part of your ministry. Together, we can share hope that can not only save the spiritual lives, but save the actual life of people we probably will never meet, but whose lives matter and whose lives will make a difference. Join the movement. Sign up to get all of the information, the toolkit. Use the hashtag 988day of faith in action, and wear purple and teal. Purple is one of my favorite colors, and so I'll be wearing purple to share the hope, to share the love, to share 988. And I'll do it in honor of those I have lost to suicide, knowing that we are not helpless to save lives. Thank you.
Reverend Dr. Sarah Lund, thank you so much for that beautiful reflection, for the ways in which you're working throughout the United Church of Christ and encouraging other traditions to think about mental health challenges and suicide prevention and substance use disorder, and thinking again too, not just about the people in our communities, not just about the clergy themselves, but also our youth, and the amazing ways that we can make sure all of those individuals have the resources they need to be safe, to connect to resources, and to receive the support that they need. So thank you so much for that work that you're doing. Thank you everyone who's been here with us today. I want to share the slides again real quick to say some of those 5 ways that you can be involved. You've already heard Reverend Dr. Sarah Lund kind of give some beautiful examples of the ways she and her community are looking at doing some of this work. You too can be part of this movement. So right after this webinar, you're going to be taken to a survey. That survey will have a link where you can say about some of the ways you plan on doing this. What are some of the steps you plan to take with your community to address some of these challenges? And we so look forward to hearing about the ways and seeing them up on that wall where you can talk and use that hashtag to show people about the amazing work that you're doing in the community and be part of this national movement to increase awareness about 988 in as many communities and as many cell phone address books, adding that phone number into your contact list to make sure people know how to connect and connect quickly if they need it to that service and support. We thank all of our presenters. I want to honor and thank SAMHSA, the 988 team, for joining us today. I want to thank Reverend Sheffield, Imam Musa, Reverend Dr. Sarah Lund, and the amazing work they're doing in their communities to address these challenges. We'll make sure this recording is available. We'll send that link out to everyone who's participated and those who registered. And we hope you'll use that hashtag 988day or 988day faith in action to let us know about the amazing work and ways you're helping more people in your community know about the resources they have to connect to someone with it who can provide the support that's needed in their lives if they need it. We thank everyone for being here with us today. We will follow up soon with additional information, and we look forward to seeing your post up on that wall for the 988 Day and 988 Day Faith in Action. Thanks everyone for being with us. Have an amazing day.